One of the exciting things that we have is the Prexion 3D or Prexion Cone Beam CT. The Prexion scanner basically is a technology that we are able to incorporate into treatment planning so that patients get a much more reliable, much more successful outcome. We're able to do things just much more efficiently with this scanner. As you can see, much more efficient than our previous x-rays. We have a digital scan. I'll give you a little bit of a tour of the things that we look for at the office when you come and have a scan done. What we're looking at is what's called the craniofacial complex. It's really where we work. And when it comes to teeth and when it comes to everything involved with teeth, we sometimes get caught up in what we can see visually and forget that all the things that are going on underneath the soft tissue and underneath and into the bone. One of the things about the scan that we'll first note, if we blow this picture up or this image up, we can see that these teeth are much longer than what we really realize. We really only see the tip of the iceberg, but most of the tooth is anchored in the bone, and that's what gives our teeth strength and stability for when we function throughout our day-to-day activities. And so what I'm looking for at first is I just want to see the bone levels. I want to see how much bone support we have, if the teeth are correctly together, if everything is dancing well. We like to think of the upper jaw and the lower jaw as dance partners. We want to see, do they dance well together? These teeth mesh up really well. And this patient, she looks great. Very, very good teeth, very, very good bone levels. One thing that we will note, however, is that if we go to this view, we can see that in her case, she has some third molars or some wisdom teeth that are what we would call partially or fully impacted depending upon what tooth we're talking about. In her case, she had some symptoms that went along with these third molars that required that we go ahead and extract them. And so for our treatment planning, what we did is by having this scan, we're able to really recognize exactly where we're going with things. How is this tooth going to come out easiest? What's going to be the most comfortable way to get this tooth out and to get that patient comfortable so that she can get back to doing her daily activities. So we were able to look with very, very good detail. I mean, we can zoom in and really know this tooth is actually buried under mostly bone and then some soft tissue. And so being able to see exactly what we're working with before we get there really stacks the deck in your favor. When we look at this third molar, there's a nerve that runs down through the lower jaw that we want to make sure that we avoid for the safety of the patient. So being able to have this scan increases the level of safety exponentially, and it really helps us to go with both eyes wide open, knowing exactly what our game plan is for the removal of those wisdom teeth in her case. A couple other things that we'll note, you can see the cheekbones right up here. Really, all these things form the way our facial features look. We have the nasal airway right here. If we tilt her downwards, we can actually see into the sinuses right here. We can see the nasal airway through this angle. If we want to make a sideways cut in half, we can actually see that nasal airway. We can see the hard palate, soft palate, the tongue, the floor of the mouth, all the things that we would be looking for. And here's an inside view, basically from the tongue view in, of where that hidden wisdom tooth is, where the rest of the teeth are, and the formation of the bone that supports the teeth. And so this has been a great asset that we've been able to incorporate into our practice that's really helped us to just do things easier, make things simpler for the patient, and much more predictable. This is a fun case that I thought I'd get a chance to show you. This is a patient of mine who's in orthodontics. One of the local orthodontists is doing the braces, but he asked for my help in finding out where the location of this canine was. This canine hadn't come down and it was lodged up into the bone and hasn't erupted the way it should. So what we're able to do with this scan is know exactly where that tooth was. In fact, what we ended up doing was we can take away the lower teeth so that we can really see in great detail, okay, here's this canine that's for one reason or another not coming down into the position that it needs to be in. It's basically locked in the bone right there. So what we're able to do with this scan is get a really perfect picture of exactly where that is. And so what we were able to do in her case was we used our laser. We accessed where this tooth was. The laser cuts perfectly clean. There's no bleeding. There's very little postoperative discomfort. And we were able to attach a button, a little small button, onto this tooth. with teamwork and the help from the orthodontist, he was able to hook that button up into the wire that you see right here, the orthodontic wire, and gently bring that tooth right down into place. And within a short period of time, this patient was able to have this canine placed exactly into the position it should have been in. And it's this cone beam CT, or this CT technology, that allows us to visualize and make a game plan and know exactly where something like this is. This is another case. This is a orthodontic patient who's in what's called mixed dentition. She has part of some of her permanent teeth that have come in, and some of her baby teeth that are still in the process of exfoliating or coming out. And so with this view, we're able to get a really nice image of where everything is, how far along she is on her progression, as far as this is a baby tooth, this is a permanent tooth, pushing that baby tooth out. We can see that this permanent tooth is finding its place into where it's supposed to go. This canine, this premolar, these are all drifting into the position that they need to be in. But mixed dentition, or those young people that have teeth coming in and teeth coming out, knowing exactly where we are as far as their overall health and overall treatment is a very, very important part of orthodontic planning. And with an orthodontist, the orthodontists I work with here in the local area are wonderful about working with me on these things, and oftentimes request this special image so that they can see exactly where that patient is in this critical time of development. The cone beam CT, the CT scanner that we have in our office, is extremely helpful for a number of things. Everything from endodontics or root canals to implants to wisdom teeth, bone grafts, treatment planning for things that patients want, patients desire. And so in effort to see and to do the things that we need to do, this scanner has been extremely helpful. This is a patient in his mid-30s. What we can see here is he's actually missing a tooth right here, has a baby tooth that, as you can see, does not have the root development that these adult teeth have. And so he's got some areas that have some spaces. If we look on the right side, almost the exact same thing. A premolar that never formed, and another premolar that never formed, and a baby tooth that's staying in position for the time being. We know that more than 50% of the population of adults in the United States are missing one or more teeth. So when it comes to implant planning, that's where our CT scanner really, really shines. Knowing exactly what the quality of the bone is in a certain area is imperative to planning safe restorations that people will really, really be able to function with and have the aesthetic look that we're looking for. And so with this scanner, we can zoom right into the bone. We can actually do this. We have 3 different images here. This one's a cross section, this one's a different cross section, and in any of these sections we can maneuver our image so that we know exactly what we're dealing with. And what we're doing here is just evaluating the quality of the bone, how much room we have to work with, what size implant we can place. With a measuring tool that's incorporated into the software, we can make a precise measurement towards important structures. For example, in this patient, the inferior alveolar canal, sometimes called the IA canal, which is the 3rd branch of the trigeminal nerve. For those who are interested, it's 15.63 millimeters from the crest of the bone at the top here. Well, that's important for us to know. When we place implants, we need to make sure that your safety is priority, that everything is stacked in your deck to have the highest rate of success with your long-term outcomes. And we have incorporated this technology into our office for that very reason, so people can be happy with the reliable outcomes that we'd like to see.